welcome back, ladies and gentlemen, to another episode of the Bright Brains podcast. Today, my guest is David Quenzer. He is a physical therapist, and he has a history of dealing with chronic pain, and he has discovered a new solution for this chronic pain. And I want to talk to him about his journey and what this solution is. So, welcome to the show, David Quenzer.
Thank you
Tell
for
us a
being
little.
here. Yeah.
Hey, no problem. So, tell us a little bit about yourself and your background.
I've been a physical therapist for 7 years. And my background is in the like a neuroscience population for mainly brain injuries, strokes, car accidents. But I've taken that neuroscience approach and applied that to what we call orthopedics, so like joint issues, chronic pain. So I'm taking, instead of just a direct approach, I'm bringing in some brain science, I'm bringing in some manual therapy, and then packaging that and then calling it a different solution because it's a little bit different than just a regular insurance-based physical therapist that you probably worked with.
I'm Ike.
And I'm Vera, and we're the hosts of the new podcast, Odd Brains, premiering September 1st on Patreon.
Join us now for early access to exclusive content that will otherwise not be available until our official YouTube launch later this year.
Decriminalized is the first installment of the Odd Brains series. Join us as we chat with an EMS from Portland and San Francisco, Colton Perry of the podcast Just Dumb Enough.
Okay. Check it out on Patreon, dropping September 1st, and stay tuned for further updates about additional episodes and other projects to come. You can support the Vagabond Initiative by joining our Patreon and spreading the word. Also, check out www.badproduct.co with coupon code VAGABARD. That's VAGABARD for 10% off. We appreciate any engagement whatsoever, and all proceeds will be used to reinvest into the brand. The link is in the bio below. All right, then. Awesome. So let's hop into it. What led you to become a physical therapist and get into this line of work?
Yeah. So about 15 years ago, the healthcare profession looked very different in the United States. My mom tore the labrum in her right shoulder. So she had surgery, and then she wasn't allowed to drive or, move the steering wheel in her car. So I was driving her to physical therapy. And at the time, therapists saw the patient almost entirely on their own. The aides were just helping maybe like 5 or 10 minutes out of a session. So for about 45 minutes to an hour, that physical therapist was assessing and treating my mom and getting her shoulder back like in a really fast way, like much faster than I expected her recovery to be. And I saw that therapist just really take care of my mom. And so the next summer I came back and shadowed this physical therapist just to see what it would be like if I was in his shoes.
That's pretty cool. So you're saying that when your mom had her surgery, the physical therapist 15 years ago, he did a better job of healing her than physical therapists do now?
That's correct. Yeah, because anyone that's gone to therapy in the last, or basically since COVID, knows that, and myself included, I've gone through therapy since COVID. You spend maybe 10 minutes with a physical therapist, and the rest of the time is spent with an aide that makes minimum wage. So that aide isn't trained in school. They're just trained on the little details, whatever the manager says they should know about, but there's no anatomy, there's no physiology, there's no assessment. So that it's basically now an aide spending 90% of the time with the patient, and the therapist just kind of supervising. And it's very different.
That's interesting. So these aides, you said they have no training whatsoever. So what, they're just hiring randoms off the street to work with, people, and they're not giving them any direction or anything?
A little bit above that. So we'll say, for example, a business like a physical therapy business is going to hire someone that's, maybe in college, someone that has some, they have some education background, but they don't have to have any science background at all. They don't have any anatomy, physiology, or a medical background. But if they just check off these competencies, like maybe they can put an ice pack on someone safely, they can change hot water, they can go through an exercise here or there and show that I can move some person's arm like this, and then we go like this, and we go like this, and 3 sets of 10, and you're going to be better. And then they do the same thing for every single person with a shoulder injury, and that's what our medical model. That's what we're allowing things to do, and people aren't complaining. People are upset with it, but people aren't telling their insurance, "Hey, this is not high quality therapy. I'm not really getting better as I should be." So it aids that are they're trained in competencies, like they're checked off of different skills. They don't have a medical background to assess. They're not trained to do any kind of assessment, or if someone's in pain during the exercise, they're going to have to stop that movement, go to the therapist, and or some aides just say, "Oh, I know what I'm doing. I've been doing this for 10 years. I'm an aide." And they'll just keep pushing the exercise through, and the patient won't get better because it's the aide that's assessing with no formal training.
So you said people aren't complaining. It could be they just aren't aware because
Right.
this is the first time I've heard about this. So is it like a cost cutting measure that they're doing this for, or is it just is there more people who need physical therapy and not enough people who are quality trained, or is it a little bit of both?
I think you said it perfectly. It's both. So there's more people that are injured, that are maybe they're just at their job, they're creating a process of chronic pain. They didn't fully recover from their last injury, so that injury builds and adds to something else. Like, for example, you get a shoulder injury, and that shoulder injury doesn't fully get to 100%. Generally now in therapy, they'll only get you about 75% of 100%, because insurance will stop paying for more visits. So there's a lot of layers here, but we'll try to be simple. And then that shoulder injury, because it's not 100%, is going to cause you to turn your neck more stiffly and like not use your neck as well. So now you got a neck injury in development, yet it hasn't fully realized, but you got something that's now not fully working because the shoulder is literally connected to your neck. So if one thing is not healed, then it's going to affect and negatively move another joint. Either that joint is above, like the neck, or below, like the ribs and breathing. It's going to be affected.
So you've actually had your own experience with chronic pain, right?
Yeah. Yep.
And so let's talk about what that was and how your experience in physical therapy. So what was your affliction?
Yeah. The irony was it happened actually. It began when I was in physical therapy school. Because you're spending a lot of time studying, you're spending a lot of time sitting, you're in a stressful environment. So that's where it started, and then it got worse as I spent a lot of time documenting on patient care and taking care of other people, but not realizing that my own body, I wasn't taking care of my own body as well as I should, and I wasn't actively seeking, working with a physical therapist or working with a chiropractor. I wasn't working with anyone in the medical field to take care of my own body during the time. So I just kind of pushed things aside and thought, oh, things are going to get better, and they didn't. And so I started compensating, meaning that instead of using my core for stability and core for lifting, I was using my low back because it was really strong, and
Mm.
that's at my own detriment. There's a lot of people with low back injuries, and I was creating a low back injury because I was overusing my back for everything.
Gotcha. So you started having pain in your lower back, and how was this affecting your day to day? Was it just, hard to sit, hard to do anything, or
Yeah, for me, it was hard to stay in one spot for more than about 30 minutes. So whether I was sitting or standing, if I was in any position, if I stayed in one position, my low back would just lock up, and I feel like my kind of the muscles on either side of my spine would just become like ropes. And then, then I started, trying to massage therapist, and it would keep my back relaxed for a couple of days. But I knew that wasn't like hitting the root of what was going on. But I didn't know anyone that like could target what was really going on underneath. So I asked some other therapists in town, and they would give me an exercise or two, but it was kind of back to this modern physical therapy, like, oh, just do this exercise, it'll get you better. But I felt like it was just so generic that they were giving the same exercise to 100 other people with low back pain. It wasn't specific to how I was moving or even the cause of my low back pain.
and you being in school for physical therapy, were you learning things that could help you understand your situation, or was it not any help at all?
I was, and that was the irony and kind of the shame of that too. Is like I was learning techniques and methods to help other people with low back pain, but a lot of those methods are hands-on, like manual therapy. And during school, no one's really good enough to like really overcome. They'll start the process to get someone better. So I had some colleagues and coworkers that were good at starting the process, getting me in the right direction, but their skill level wasn't what I needed at the time. It wasn't enough to progress me to reach the end. And I was still thinking exercise we're gonna fix my issue. That was still about 10 years ago, when there was still a big exercise push in therapy. That's even more so now. But thinking that, oh, just doing a couple exercises each day is gonna improve it, or stretching. I thought stretching was the answer, but yes. In another podcast, we'll probably talk about how stretching is really non-specific. You're only stretching the most weakest segment, and you're not stretching the tightest segment. So that actually made my back pain worse by following some doctor's orders of make sure I'm stretching every day.
All right, then. So you said exercise and stretching didn't fix the problem.
Right.
So what is it that fixed the problem, and how did you discover what that solution was?
Yeah. So I started taking after I graduated, and I went through a residency in the Bay Area in Quenzer, which was wonderful, and started opening my eyes to how our body is supposed to move, like in a developmental sequence. It's called PNF. It's at Kaiser Vallejo. That's where it was founded. And so that gave me a foundation. So that's a foundation to bringing the neuroscience approach into orthopedics. And then that was layered upon a group of therapists. I think the best manual therapists in the world, through an organization called Institute of Physical Art. And notice how the ending is art, because restoration of pain, you should think of it more as an art form, not as a blueprint. You can't just give someone the same exercise for everyone. You have to think of as like an art. Everyone's created different. Every body, every injury is different. Even if they have a low back pain, it's not going to look different. So I finally found some classes that I was taking to help other people, and in the process, one of my instructors was able to help me. And so I kept going back every month. I've been going back with the same organization for the last 2 years and taking classes. I've probably taken maybe about 400 hours worth of classes. And really, it just is a difference of taking the neuroscience of how the brain and the body works together, and how you add hands on instead of hands off. So as a trend goes more telehealth and hands off therapy, the body really needs hands on, because that's the only way to feel what muscles are working at the right time, the right intensity, and for the right duration.
Gotcha. So the techniques that you learned at this place, the Institute for Physical Art, I believe is what you called it.
Correct.
So the techniques that you learned there what helped you fix your chronic pain?
Yeah, but I wasn't able to fix it myself. It was, it was the instructors there that I worked with after the class and said, "Hey, can you work on me? I don't really care at this point how much it costs or how much time it's going to take, but when you're desperate, if someone has a solution," and I've seen them in the class restore other people's low back pain. So I think you can work on mine too. It looks kind of similar. So yeah, with a really good assessment that's hands-on, after about 5 visits, 5 more classes coming up there, I would say my back pain is resolved. The chronic pain is done, but that doesn't mean I can just sit back and do anything. So I have to maintain it a little bit, but the pain itself, I'm sitting here without any pain. And by 20 minutes into this conversation, I would have definitely had to walk around and move around. I wouldn't be still sitting here if this was just a year ago.
So what is it that they did differently that physical therapists at your school, and or what's currently going on in physical therapy? What is it that this institute is doing differently?
Yeah, they have a 3-pillar approach, which is, it just paints the lens of how you see movement. So we'll make, I'll say a kind of a complicated word, and I'll make it simple. So like mechanical capacity. It's one of the pillars. So mechanical meaning like joints and movements. So mechanical capacity is like, how much can the joint itself the segment actually move on itself. So like say they got two fists right here. So these fists they can rotate like this, they can shear and slide, or they can bend like this. So the joint, if this is your spine, all the segments of your spine, just like this, like that, all the segments of the spine should be able to do all the things. They should be able to spin, glide, pivot on itself. And when they looked at my back, all I was doing was just pivoting. I was missing the other parts of rotation, of sliding. So if I was just pivoting on one joint, you have kind of three big sections of your spine. But for most people that have low back pain, their L5, lumbar 5, which is the last lumbar spinal segment, and their S1, sacral segment, is usually the most flexible and too much mobility, not enough stability. So that was true for myself. They found too much motion here, and I wasn't getting all these other nuanced motion of the spine. So they looked at that. They provided those other nuanced, smaller motions above and below that dysfunctional level. So that way the spine wasn't just 100% moving on one level. It was divvying up that load of motion for the whole spine. So that was, my spine wasn't working well. And that's your core. I mean, that's a central part of your body to generate force.
So how were they able to see all this? Did they have like some kind of imaging, like X-ray they did, or were they able to tell all this just by being hands-on?
Yeah, being hands-on. That's another thing that I think America needs to wake up to is you can have. So I had an MRI done on my spine. They said, oh, I have a disc herniation. I've got this amount of millimeters of protrusion. If this gets worse, you're gonna have to have spinal surgery, like a fusion. Like they're gonna fuse my spine segments together to not let it bend anymore. And instead of going that route of listening to the traditional medical model of pushing surgeries, that's why I feel like America loves pushing surgeries, loves pushing medications. I said I want to try another direction before I go to surgery. So then that's when, about the same time, taking those classes through the Institute of Physical Art, which a lot of those people were trained through that Kaiser program, seeing the brain and the muscle as kind of working together. So a long story short would say, having someone with really good hands-on assessment allows someone to know what to do next, how to see that mechanical capacity, can it move? And then can the neuromuscular, so the brain to muscle connection, can the muscles fire right? And then the last pillar of the Institute of Physical Art or of any kind of therapy is a motor control. So mechanical capacity, brain to muscle connection, and movement control. Can you move the spine in a way that's going to be controlled, and it's not going to be an all or nothing approach? And I'm not employed by Institute of Physical Art or Kaiser Vallejo. Just I want to give credit to where that helped with my pain, because I'm taking those classes. I'm bringing those classes from the Bay Area and from LA and bringing it to like a kind of a more there's not much education in Central California, but that's actually true of a lot of other states too. You just in the really big cities, you have a lot of education, and then those therapists don't come and treat in kind of the smaller areas of the state.
Has there been any kind of pushback against these teachings?
A little bit, I would say. Physicians want to go the standard route of dropping people off at your insurance physical therapist, seeing them for, I don't know if, I can't say if there's any favors or anything done like that. I don't think so, but I just think that there's just doctors have done this model for a long time. Like you go through regular insurance, you go get your therapy in for 2 or 3 times a week for 2 or 3 months. So I went through 3 months of physical therapy twice a week. And at the end of it, I feel like I wasted a lot of time off. Like I had to take time off work, 2 hours every visit. So overall, all the time I wasted from work, it would have been about 3 hours, $3,000 worth of PTO time. Like, sure, I didn't pay directly out of pocket, but if you think about as a time off, I could have gone on 2 vacations on the time that I spent on PTO. So you have to kind of think about how much is time and how much is money worth for you. Like if back to like a car mechanic and your car analogy, you don't want to drive a car that's not going to be reliable. You just want to hop in the car and start driving your car. So you're going to take your car to a mechanic that's trustworthy. If there's something, an issue, transmission's not working on your car, you want that transmission fixed. You want that issue resolved, and not just like, I could go out in any second, I could be stranded, but at least I'm saving money. Like, I've never heard of anyone that says, at least I'm saving $2,000 by not taking my car to a good mechanic. I just spent $500 on a cheap mechanic, and I think it'll be okay. But that's something that you want really reliable. And how much more so do you want your body reliable? And because you can't replace it, that's it. You can have surgeries, you can have medicine, but you can't replace his body. This is it. You can't just buy another car.
Yeah, yeah. It's interesting how much, we still don't really know about the human body. Everything we know about the human body, we had to learn,
Right.
which is,
Right.
I always get kind of fascinated about that. Like, our bodies didn't come with an instruction manual, all of human history, we had to like basically cut people cadavers open and learn everything through trial and error. They had to learn how to do a heart transplant. They had to learn how the spine
Right.
works
Right.
and things like that. And I guess we're still learning. Like you say, you're learning these techniques and you're trying to bring them out of the big city and bring them out to the world. One of these techniques you said is something, I'm not sure if you said you created this or not, but it said the release of multi-layer skin adhesions. This is something that you had wrote about in our exchange. Well, what is that? Your exact words were, you said you could cure pain without surgery or pills using nerve mobility through the release of multi-layer skin adhesions.
Yeah.
What is
Yeah, let's unpack that. So, let's take a healthy person. So, in as we walk, as we reach up our arms and move. So, let's take this hand for example. Let's go like this. So, as I bend this hand back and forth, for me, there's no pain at all. And who's ever watching or listening, I want you to try this too. Just bring your hand up like this, and your fingers up, pointed up towards the ceiling. So, as I bring the fingers back and I extend and I kind of arch my hand backwards, that nerve in the front is gliding inside the muscle. So nerves often are kind of woven in between muscles and they attach to different areas, whether it's attaching to the muscle to innervate or to move the muscle, or maybe they're attaching to the skin. Either way, those nerves must be able to glide, right? Because nerves don't stretch. They're like really hard. They feel like really hard noodles, to be honest, when I felt them. So they have to be able to move, and that means people that have carpal tunnel, like for example, oftentimes those nerves aren't moving; they're getting trapped in there with inflammation, other issues like that. But in a healthy hand, all the nerves need to be able to move. So, say back to the carpal tunnel. Say if this skin was really tight, meaning I adhered, or like think of like saran wrap. If you wrap saran wrap around a package just a couple times, think of how hard it would be to open that package. That's just like maybe 3 layers of saran wrap. But imagine if that you've had pain for years, you're going to keep wrapping that saran wrap because that motion hasn't happened, and the body keeps stabilizing areas that hasn't moved, and they'll keep allowing things to mobilize areas where you are moving. So the body is really, really efficient. It'll lock down areas where it doesn't seem of value to move, and allow other areas that are like, oh, I have to reach my hand over my head, so I want to make sure my shoulder in this area is not tight, but I've got back pain. So now I'm going to wrap essentially fascia, which is just it's like the web-like or saran wrap around your body. It has some tension in it, which is healthy. It's not bad to have fascia, but it can, as it lays down, as it does every morning, right? You wake up in the morning, you're like, I'm a little bit stiff. Like, it's different when you're a kid. Your fascia was all springy and mobile and flexible. As we get older, oftentimes that fascia, that web-like, layers down during the night because we didn't sleep well enough or drink water enough. So this all comes back to, if we move in certain ways, we can keep that mobility happening for the rest of their life. I know people in their 90s that are sprinting, and I know people in their 40s that are just stuck in bed because they're in chronic pain. So it's not directly the age; it's what you're doing with your body, how much skilled intervention you're doing like with your body. So that person that's 40 that's stuck in bed doesn't mean that it's a life sentence staying in bed. That means that we have to peel off layers of what's causing the pain. So that's like talking about the adhesions, right? Talking about the adhesions to the nerves. So say if that person that's 40 is in a lot of pain, going back to the carpal tunnel or the sciatic nerve, let's look at the skin. Can that skin lift and allow blood flow and that nerve to slide underneath there? So that's that adhesion. So if I can release the adhesions through some different skin techniques of lifting, gliding, spinning, perpendicular deformation, these are just fancy terms that just mean different skin movements, then I at least have the first layer free. Now I can go underneath and I can move. See how I move my fingers? So my nerve on the end of my fingers is now bending like this. And if I wanted to move it a little bit more, I might keep my fingers there and just move my wrist. Or I can go like this and I'm moving just this segment right here. So this same nerve in my hand is moving in different ways, right? It's moving at the pivot here, or it could be moving if I go like this. Now this is all stabilized and this is pivoting right here. So look at how complicated just in the hand and wrist is. Imagine your low back with all the segments of the spine, and the spine doesn't just move forward and backwards, but it has, like we said, gliding, twisting, spinning, rolling. I took a therapist to see that 3 out of 4 movements of the spine were not happening for mine. We're stiff and not springy like a healthy tissue. And that's really what they saw. Oh, you're not moving in these ways. So the body's working too hard and inefficiently. So that's pulling us back in. We need an efficient system to give us options for movement. And that allows us not to be in so much pain. Because when people that, like myself, I kept moving one joint over and over and over again in just that one segment without the stability of my core. And that's what led to breakdown, I think, and then I ended up with pain.
All right. So these skin adhesions, you're just kind of pulling on the skin around an area of pain. Is that essentially what it is, or is there more to it?
So sometimes I'll work with someone on the first visit and just say, I need you to work on this on your own. I'm going to train you how to do this on your own. And this is something you could do just the first level on your own. And then when they come back and work with me for something that's a little more complicated, like nerve gliding, muscle gliding, joint gliding, we can work. That'll take someone hands-on working with you. But you can mobilize. If you've ever had wrist issues like this, like see my wrist, let's see, it doesn't even extend all the way right now. It's tight right here. If the next 10 minutes, if I just worked on the skin, so I'd want to work on the skin in this direction, right? Because I'm working on the wrist going this way. So I would want to work on the skin, make sure it can glide in this way. So I could roll up the skin, I could mobilize and make sure the skin moves. And the skin's, the biggest organ in your body. So you have to think about it as an organ, not just like dead tissue. So the skin should have flexibility, should have attention to it. So if I go, this is IPA term, but it's called 3D localization. So I can look at if the skin moves and glides in one direction, I'm going to rotate my hand just a little bit. I'm right on the wrist and find an area where the skin doesn't glide anymore. It's find where the skin is tight. And actually this direction right here in me, I can't glide the skin as well as I could. See how the skin moves up and down really freely? I go this way, It stops. So I would mobilize the skin. We're not even doing the joints like a chiropractor. We're not doing the muscles like a massage therapist. I'm just working on the skin. Just the first layer of my adhesion. And I'm going to mobilize this. I'm going to twist the skin. I'm going to lift it up. I'm going to do some active motions of the wrist. I'm going to allow that skin to free up. And now I can go and take off. So now my first layer of adhesion with the skin is now a little more free. Now I can get into more of the muscles and joints and even be able to feel the nerve, which I couldn't feel the nerve before because the skin was just so much tension. I couldn't get to even put my hand deep enough. So thinking through some of this you might be able to do it on your own, which is great. If I can help someone do some of these, like start feeling better on their own, that's perfect. They'll come to a point where you're like, I can't do this anymore on my own. I'm not sure what's next. And that's where I can help people or other therapists that are trained in this kind of a solution-based manual therapy approach can help with.
All right. So this is pretty interesting. When you are talking about how it's the skin that's tightening, and that's what it is that you work with. It made me think about acupuncture,
Mm.
and how they stick those needles into the skin. I
Mhm.
wonder, is there like a similarity there between acupuncture and what you do at all?
I think so. Acupuncture is a really old medicine that has to do with energy flow and chi. So that's something that I don't understand well enough to, but I've had acupuncture for a little bit done on myself, and I feel like there's a kind of a multimodal relief of that. So first, the acupuncture, it might be you're desensitizing the skin, right? You're putting a dry needle into the skin, so the skin is no longer maybe as guarded. So if it can handle the dry needle, it can surely handle things that would cause less pain. Um, and then also you are changing the fascia. You're disrupting kind of that skin and layer underneath in a good way. So you might do acupuncture, and then I think it'd be good to retrain the system. So like acupuncture is a very passive approach. You go to a therapist, they do the acupuncture, and they're very skilled. I have no I highly respect acupuncturists. But after that, there's usually not a brain to muscle connection training that happens afterwards. So say if you have more range of motion, right? Or you go to massage, get more range of motion, you need to train your brain to utilize a new range of motion. Just like back to my wrist. If I just mobilized the skin and someone did acupuncture throughout my forearm right there, and I was able to move my hand better afterwards, but if I didn't reinforce the motion, I didn't strengthen the muscles on the opposite side to keep that range there, it's going to go right back. Next morning, I'm going to go right back to where I started, because that brain still perceives my body having less motion. And it's going to live as if I have less motion, because it hasn't retrained itself. It hasn't relearned to utilize that new motion that the acupuncture or massage gave it.
Hey, sorry to interrupt, but are you looking to reach a dynamic and engaged audience of curious minds? Well, look no further. Bright Brains Podcast is the perfect platform to showcase your business or product. You'll be able to reach a diverse and intelligent audience and engage with listeners passionate about personal development, technology, and more. Elevate your brand through thought-provoking discussions. Don't miss this opportunity to promote your business on one of the fastest growing podcasts in the market. Contact us today to discuss advertising options and elevate your brand to the next level. Contact us at brightbrainspod@gmail.com to secure your advertising spot on Bright Brains today. Again, that's Bright Brains with a Z, pod, P-O-D, @gmail.com. Now, back to the podcast.
All right, Dan. So I'm curious, what is your opinion on chiropractic? I know lately there's been a lot of pushback against it, people saying there's like pseudoscience and it's not real. From your perspective as a physical therapist, how do you feel about chiropractic? Is it, how do you feel about it?
Yeah. First off, I actually don't think there's as much tension between physical therapists and chiropractics. I think there's a lot of complementary aspects that can go on. Chiropractors, from what I understand and from what they've shared with me, are more focused on the joint, basically the spine. They're really focused on the spine, which they're experts at it's called grade 5 manipulations. There's 5 grades. Won't go into that, but 5 is that pop, that cavitation, that the air shifting. But what a chiropractor will tell me is they're not always putting someone back into place. They can cavitate and pop someone's neck or their back, and that's just a release in the air. That's a kind of a tension inside the joint space, and it moves and actually goes right back to place. That's something that people don't quite understand about a chiropractor, is they're not always putting a joint back into place when they pop a joint. So they're just manipulating and popping the joint, releasing the air cavity, and that creates it's called endorphins, so a feel-good response afterwards. The body relaxes. It can, the muscles can relax too. So that's why there's an instant muscle relaxation after that that crack happens, you're like, oh, I feel good. But where I think the issue is there's not any brain training, that neuromuscular brain training we're talking about, of the same thing as acupuncture, same thing as a massage therapist, to really train the body to utilize that new motion. So you get your adjustment, you feel great, you move around, and in a day or 2 days later, you feel the same. So that's why a lot of chiropractors see someone for 2 or 3 times a week. But if you're doing that, the patient, are you creating a dependency on the adjustments, or are you actually making the person better, like out of their pain? I think there's a lot of, maybe the tension is their chiropractors create a dependency upon the adjustments instead of an independency on having the patient develop movements that can help restore their own pain.
All right. So do you have your own practice where you do these methods that you've learned, or do you work for somebody else and you just incorporate this into your job, or
Yeah,
what is it
it's
that you,
a
yeah.
yeah. I'm right now. I'm figuring out kind of what really needs to happen to take care of to take care of the people around me. So, for the people that are local in Central California, you just type in my name, David Quenzer, PT. But what I do a little bit differently is we talk about like a outcome or a solution based approach. So I try to sell someone the solution, like as in when you're going to a mechanic, a mechanic says, I can fix your car. I think it's your transmission. It's going to cost, $1,500 to $2,000 to fix this. Allowing me to fix this is going to allow you, a lot more miles, probably another 50, 100,000 miles on your car. Do you want me to work on that with you? So I do the same kind of offer too. I don't sell visits. I don't sell a lot of packages. I'm not trying to sell a per visit or per hour charge. I want to sell the solution because I know people are trying to get to the solution. So I just want to say, hey, this solution, based on your complexity, it's pretty complex. It might be $1,800 to achieve this solution, be able to reach your hand overhead because you want to, as simple as just wash your hair without pain, or you want to do some pruning backyard, and you want to do that pain-free, and you've gone through therapy in the past, you've gone through chiropractic, but I work with people with like flexible spending or health savings. So that's like the pre-tax money. People can work with me on that. I'm also considered and this is therapists, and this is I'm not just speaking about myself, but a lot of therapists that are like what I do, that do a lot of hands-on. We're more of the approach of an out-of-network provider. That's what they call. So if you have a PPO insurance, you will have out-of-network benefits. It won't be 100% covered, but 30%, 50% of what that, say the $1,800 would probably be covered. And that's really good, because if you do the math, and I did the math on myself too, like I said, I spent $3,000 on basically time off from work, equivalency of my hourly rate, my rate times 2 hours, 3 times a week for the couple months was about $3,000. So I actually, when I work with people, it's actually saving money by spending a little bit ahead of time and upfront. For most injuries, I can get someone in 5 or 6 visits what they're looking for. So at least 50% better in 5 or 6 visits. So, but I ask someone, what is your main goals? And we pick 3 things. And I want someone to be like, I want a moonshot. I want someone like, hey, I didn't think about this at the time, but I want to run a half marathon. Like I haven't run a half marathon since my 30s. So let's have that as a moonshot. Like we might be able to get there, but we can't get there if you can't walk across the street without pain. You're not going to be able to train if you're in this much pain. So I really challenge people to get creative and to not limit themselves on what the body can achieve, because the body can restore itself with the right kind of interventions, the right therapy. So I'm a testament to that as well. I didn't run because running caused a lot of back pain. And now the other week, I just ran a 10K. I haven't run more than a mile in years, and just ran a 10K, and I was pain free, and I never felt it. Now I'm addicted to running. Now I understand all. Bought some new Hokas, and I'm going on the running route back again, because I was in track and field in college, pain free back then, but they didn't have this type of training thought process back then. It was a lot of strength training, a lot of plyometric, a lot of power, but it's not a lot of functional, like a functional manual therapy that I provide now.
All right, then. So, what are some things that you would recommend to people for like preventative maintenance? Maybe like people who are young, who aren't really dealing with any kind of chronic pain. What kind of things would it be exercises, stretches, or anything that you've discovered in your own techniques? What would you recommend to people to do?
Yeah. First is drinking a lot of water. Limit. I personally gave up alcohol, just personal reasons, but also alcohol dehydrates your body too. So drinking a lot of water. And what I mean by water, when I work with someone, I figure out how much water they really need based on, I look at this tension in their skin, and if it's a really dry, dehydrated person, that skin is gonna stay into a tent position. But see how my skin, as I pinch it, it lets go. It
Mm,
has this elasticity. So someone that's dehydrated doesn't have that. So I look at someone's skin. I ask them about, urine output, urine color, urine smell. I ask these personal questions because I need someone. The water is honestly fuel for all the organs, all the tissue, the skin. Everything is going to be based off of how much water. So it's really simple, just drinking adequate water. So that for me, that means 3 liters a day. I have to drink 3 liters a day, and if I drink half a liter less, I'll know the difference. My sleep will be less, sleep scores less. I'll be more tired. So we'll say having adequate water and also movement. I'm a big proponent of walking backwards. Everyone seems to walk, you walk forwards, you run forwards, you do everything forwards. But how about the muscles in the back of your legs? And this is coming from Ben Patrick, knees over toes guy that made this popular a couple of years ago. But this is research that's actually really old, that walking backwards helps restore knee health, because if you want strength in the forward direction, you need stability in the reverse. So for example, if I'm pushing on something forward, I want to make sure I've got the balance of force in to not let me push over, right? If I'm trying to push a box, I need to be stronger on my legs to actually have my force exert on that box. Otherwise, that box is going to topple me over. I'm going to fall over backwards. So if I have someone walk backwards for training for someone that's with knee issues, that's those two things: drinking adequate water for everyone. I'd say 2 liters minimum a day. So if someone that's listening can say, I'm going to start helping my back pain, drink 2 liters, spread it out during the day, and then start walking backwards. That's going to help your back and your knees, because if you can help your hip joint and your legs, that's a foundation for your low back. And naturally, that was one of the first things I watched on YouTube years ago. I watched Ben Patrick, knees over toes guy, and it's like, he's all about walking backwards. Like, why is this? So I was like, oh, I'll try this. And there's not a prescription of how much time to do it, but if you say you did it for 2 minutes twice a day, walking backwards, drink 2 liters of water at least, I'm very confident in a week you would notice a big change in your skin, your hair health, your face, and then also your pain. So having less stress on your body, you're also going to be less stress in your facial expressions and how you move and how you breathe. So just those two things would help someone move in the right direction without even putting hands on them, without even going the next step of working with them.
all right, then. So water and walking backwards.
Yep.
That's interesting. I'm
Odd
definitely
combination, right?
Yeah, it is. But hey, if it works, that's definitely something that I'm got the water thing down pat. I try to drink like I've got a gallon of water a day.
Yeah.
But walking backwards, that's definitely something I can do. So earlier you were mentioning about these aids, and I said that a lot of people just aren't aware. What are some other things that are currently going on, like in the medical field, that people aren't aware of and that they
Mhm.
should?
Yeah. So let's go back to an in-network provider, so like someone that just takes your insurance and sees you for therapy, that
Mm,
therapist only gets paid when you show up to your visits. So if you no show or cancel last minute, they don't get paid for that visit. So they'll take a diagnosis like, say, low back pain. And if you have good insurance that pays them out, a decent amount, they're going to want to take your insurance and your visits for that injury and kind of squeeze out the amount of visits to spread it out for a long time, because they want to make as much money per your injury as they can. So you got low back pain, the doctors, all for this too. They might say 2 or 3 times a week for 3 months. So 3 times a week for 3 months, that 12 times 3, that's 36 visits. And you're gonna have to take off 2 hours of from your time off work, because a therapy is really only open from 8 to 5 or 8 to 6. That's your work time too. So 36 visits. I mean, I know people that went through 36 visits of physical therapy and they got better, kind of. They didn't get to 100%, but that's a waste of time. That's a lot of time. That's a lot of time. I think is more valuable than money. So that's the issue of going to a traditional physical therapy route with insurance. You're actually wasting a lot of time and money, rather than just saying, hey, if you work with me, I'll just like the water and walking backwards. I'll tell you how to start from the beginning. So when you start working with me, in basically 5 to 8 visits, I'd say I can treat and get you the solution to most injuries, and avoiding pain meds and avoiding surgeries. For most injuries, that pain is an injury that happened a long time ago, but the pain just keeps persisting. So you go to you go 30 visits, 36 visits with your insurance physical therapist. A lot of those visits, again, are only 10 minutes with a physical therapist that's assessing. Most of the time is visit with an aide that is going to put you on a bike for 10 minutes. They're going to put a hot pack or a cold pack on you for 10 minutes. They're going to go through the exercises. The exercises kind of changes. Maybe it goes up in weight, goes up in reps. You're doing 3 sets of 10. Oh, next week you're doing 3 sets of 12. Then you're doing 3 sets of 15. But how do you even know those exercises are correct? It's like imagine taking a grip of darts. You have a dartboard. You're going to would you throw all the darts at a dartboard hoping they stick? That's the analogy I feel like our medical model of therapy is right now, is taking a whole bunch of exercises. This is typical. This is 10, 12 exercises, as giving you as a patient. I'm going to give you see me one time, and then to get you better, I'm going to give you 10 exercises, and we're going to have the aide walk you through that, because I don't have any time. I'm not saying this, but I don't have any time. I got to go see 2 other evals during the same hour, because 3 to 4 patients per hour is typical now in insurance physical therapy. So 1, you're not going to get individualized attention. 2, is if one of the exercises hurts you, that aide's not going to know like what to do. And 3, that responsibility of getting you better, I'm going to place on your shoulders with insurance. I'm going to say, these are exercises that you need to do. It's now your responsibility. My hands are clean. You just come in here when you feel better next week after you've done the exercises, but really it's going to be about 3 or 4 weeks, because we're all backed up. Okay, the next visit is going to be, in September. Good luck. I hope something opens up for you sooner. So it's going to be a gap in therapy sessions, like basically 3 weeks to 4 weeks before I see you again. So you're left with 10 exercises to do on your own in 3 or 4 weeks, no supervision, no check-ins, all hands off. If 2 or 3 of those exercises are actually harmful for your muscles and your back, that kind of negates all the other exercises. Like, at least you're not going as fast in the right direction as you could be, because you're being very generic. Those same 10 exercises were given to 5 other people that same day, the exact same ones that had low back injury, because, we've gotten them better in this method in the past. But yeah, how do you know the body just didn't heal itself? Like, how do you know you were the one getting them better? Whereas when people work with a more of a manual therapist, whether that's me or someone else, they know within every single visit, you're going to get better within the visit. So before, I always do a pre-test and a post-test. There's no other way to know you get better within that visit. And that post-test is always better than the pre-test. Like, I'm not setting some up for any kind of magic, but it's been consistent for the last years. I've been doing this manual therapy approach, last really 2 years, is I need the patient to see that it's better within each visit. And that's why we only need 5 or 6 visits to get you better, because if every visit you're getting better, you don't have to even stress about doing all those exercises. I just give someone one exercise, because I don't want someone bogged down and stressed out. I didn't do my exercise. I won't show up for therapy because I didn't. It's not like not doing your homework. I don't want to go to class because I didn't do my homework. I'm embarrassed, right? That we put shame on the patients for not doing what we tell them to do. But really, the patients can't see any difference with doing exercise, so they're not incentivized to do them. So my whole approach that I'm doing, which is consistent with other manual therapists, is taking that manual therapy and saying, this is the hands-on care you need in the moment. We need to get this joint moving like this and like this, and then we'll use kind of your brain and muscle to train your body how to utilize a new strength. So when you walk out the door, you're more confident in this movement, you have less pain, and you know exactly what you should be working on to reinforce that. Like that backwards walking, I might say, well, we start with backwards walking on level ground. Now I want you to walk backwards on maybe you're pulling a little bit of a sled. Maybe you're wearing a 10-pound weight vest. And that's the progression that, I would give you if you were working with me. But it's very specific. It can't be generic.
All right. Hey, this has been a really informative conversation. Before we wrap it up, I just want to say, where can people go to learn more about you and your services, and also more about just what you teach?
Yeah. So functional manual therapy is the kind of the next direction in physical therapy. So that's the opposite of what you can find with your insurance physical therapist. So functional manual therapy, breaking that down, function is like you're looking at a goal, objective that you can achieve. And manual therapy means you're hands-on. You're someone that can actually assess and treat in the moment. That's something that's very specific. So you can look up functional manual therapy as a provider. Just Google that, functional manual therapy, and see who's nearby. I'm in Central California. Eventually, I want to do like a video series, like kind of a Zoom one-on-one where I can see what and kind of how your body moves. But really, the best therapist is going to have hands-on feeling how your body moves. Is even in a Zoom, even just watching through telehealth, I still can't feel what the order of muscles are activated. How do I know just because it looks good? How do I know the right muscles are being trained? So yeah, the term would be functional manual therapist. And that's kind of the next, we're all therapists standing on the shoulders of giants from before. So we're standing on the shoulders of people about neuroscience. And we're adding that into a manual therapy hands-on approach to give solutions in a short amount of time. Yeah.
All right. Hey, this has been awesome, man. Yeah, I really learned a lot about manual therapy, dealing with chronic pain, and this has been very informative, and I think my audience will take away a lot from this. So yeah, this has been a great show, David. Is there any last words you want to get in before we call it a day?
No, this is I'm happy to be here. I'm happy to share this, and it's not so much of a self-promotion. I don't want someone to be like, I'm the only one that does this in the world. I want to say that this is a new approach for therapy, in that there is solutions, and it's going to have to be a hands-on approach, and you're going to have to work with a provider that delivers a hands-on approach to overcome your pain. You're not a vehicle, you're not a car, you can't replace your body. You should really invest in what your body is, and so that means working with someone that can offer that solution for you.
Awesome. All right, Dan.
Yeah.
Well, take care, David, and enjoy the rest of your day, man.
All right. Blessings, man. Thank you.
No problem.
All right, that's a wrap. Thank you for joining us for another enlightening conversation here on Bright Brains. I hope you've gained valuable insights and inspiration to fuel your own bright ideas. If you enjoyed today's episode, don't forget to like and subscribe, rate, and leave a review on your favorite podcast platform or however else you listen to this podcast. Also, we can be found on all major social media. Just type in Bright Brains with a Z. And remember, the brightest minds are those that never stop seeking knowledge.